Lower leg, ankle, and foot anatomy, Chapter 19. The ankle, or the talocrural region, is the spot where the foot and the leg meet. The ankle includes three joints: the ankle proper, or talocrural joint, the subtalar joint, and the inferior tibiofibular joint. The movements produced at the talocrural joint produces the movements of dorsiflexion and plantar flexion of the foot. In common usage, the term ankle refers exclusively to the ankle joint. The main bones of the ankle region are the talus in the foot and the tibia and the fibula in the lower leg. The talocrural joint is a synovial hinge joint that connects the distal ends of the tibia and the fibula with the lower limb of the proximal end of the talus. The articulation between the tibia and the talus bears more weight than the articulation between the smaller fibula and the talus. The subtalar joint, also known as the talocalcaneal joint, occurs at the meeting point of the talus and the calcaneus. The joint allows inversion and eversion of the foot, but plays no role in dorsiflexion or plantar flexion of the foot. It is considered a plain synovial joint, also commonly referred to as a condyloidal joint. The distotibial-fibular joint, or tibiofibular syndesmosis, is formed by the rough convex surface of the medial side of the distal end of the fibula and a rough concave surface on the lateral side of the tibia. The ankle joint is bound by the strong deltoid ligament and three lateral ligaments: the anterior talofibular ligament, the posterior talofibular ligament, and the calcaneofibular ligament. The deltoid ligament supports the medial side of the joint and is attached at the medial malleolus of the tibia and connects in four places to the talar shelf of the calcaneus, calcaneonavicular ligament, the navicular tuberosity, and to the medial surface of the talus. The anterior and posterior talofibular ligaments support the lateral side of the joint from the lateral malleolus of the fibula to the dorsal and ventral ends of the talus. The calcaneofibular ligament is attached at the lateral malleolus to the lateral surface of the calcaneus. Though it does not span across the ankle joint itself, the syndesmotic ligament also makes an important contribution to the stability of the ankle. This ligament spans the syndesmosis, which is the term for the articulation between the medial aspect of the distal fibula and the lateral aspect of the distal tibia. An isolated injury to this ligament is often called a high ankle sprain. The bony architecture of the ankle joint is most stable in dorsiflexion. Thus, a sprained ankle is most likely to occur when the ankle is plantar flexed, as ligamentous support is more important in this position. The classic ankle sprain involves the anterior talofibular ligament, which is also the most commonly injured ligament during inversion sprains. Another ligament that can be injured in severe ankle sprain is the calcaneofibular ligament. The human foot is a highly developed, biomechanically complex structure that serves to bear the weight of the body as well as forces many times the weight of the human body during propulsion and locomotion. About 26 bones in the human foot provide structural support. They can be grouped into three parts as follows: the tarsal bones, which there are 7, the metatarsal bones, which there are 5, and the phalanges, which are 14 bones. Apart from these main bones, the sesamoid bones help improve function and are often found as variants of the accessory bones. The foot itself can be divided into three parts: the hindfoot, the midfoot, and the forefoot. The hindfoot is composed of 2 of the 7 tarsal bones, the talus and the calcaneus. The midfoot contains the rest of the tarsal bones, including the 3 cuneiforms, medial, intermediate, and lateral, as well as the cuboid and the navicular. And the forefoot contains the 5 metatarsals and the 14 phalanges. The metatarsals and phalanges look much the same as the metacarpals and phalanges in the hands. The toes are counted 1 through 5, starting at the big toe and working towards the pinky toe. The first toe has 2 phalanges, a proximal and a distal. Toes 2 through 5 have 3 phalanges each, a proximal, middle, and distal phalange. A sesamoid bone is embedded in a tendon. Sesamoids are found in several joints in the body. In the normal foot, the sesamoids are 2 pea-shaped bones that are located in the ball of the foot beneath the big toe. They act as a pulley for the tendons. The sesamoids help the big toe move normally and provide leverage when the big toe pushes off during running or walking. The sesamoids also serve as a weight-bearing surface for the first metatarsal bone, the long bone that connects to the big toe, absorbing the weight that's placed on the ball of the foot when walking, running, and jumping. Again, the joints of the toes are very similar to the joints of the hands. There are 5 metatarsal phalangeal joints. Each metatarsal phalangeal joint allows for the movement of flexion, extension, adduction, and abduction. Each joint has a medial and lateral collateral ligament for support. As far as the interphalangeal joints, the first toe is different than toes 2 through 5. The first toe only has 2 phalanges and 1 interphalangeal joint. Toes 2 through 5 have 3 phalanges and have a distal interphalangeal joint, or a DIP, as well as a proximal interphalangeal joint, a PIP. Only the movements of flexion and extension are allowed at the interphalangeal joints of all the toes. The interphalangeal joints have a medial and lateral collateral ligament for support as well. The plantar fascia is a thick connective tissue, or an aponeurosis, which supports the arch on the bottom or plantar side of the foot. It runs from the tuberosity of the calcaneus forward to the heads of the metatarsals, the bones between each toe, and the bones of the midfoot. Under normal circumstances, the plantar fascia acts as a shock-absorbing bowstring within the arch of the foot. If the tension on this bowstring becomes too great, irritation or inflammation can occur, causing pain. Chronic inflammation may eventually cause a heel spur or plantar fasciitis. The arches of the foot are formed by the tarsal and metatarsal bones and are strengthened by ligaments and tendons, which allow the foot to support the weight during locomotion. Pes cavus, or a high arch, is a human foot type in which the sole of the foot is distinctly hollow when bearing weight. That is, there is a fixed plantar flexion of the foot. Population-based studies suggest the prevalence of a cavus foot is approximately 10%. Flat feet, also called pes planus or fallen arches, is a postural deformity in which the arches of the foot collapse. The entire sole of the foot comes into complete or near complete contact with the ground. Some individuals, an estimated 20 to 30% of the general population, have an arch that simply never develops in one foot, unilaterally, or both feet, bilaterally. There's a functional relationship between the structure of the arch and the foot and the biomechanics of the lower leg. The arch provides an elastic, springy connection between the forefoot and the hindfoot. This association safeguards so that the majority of the forces incurred during weight bearing of the foot can be dissipated before the force reaches the long bones of the leg and thigh. The length of your toes should be considered for the purchase of shoes to make sure that they fit right. All shoes should be measured by the longest toe. You should have 1 thumb length between the longest toe and the toe box of the shoe. In addition, biomechanically speaking, the longest toe typically carries more of the weight-bearing load during the push-off phase of walking or running. If your first and second toes are the same length, then you have a square foot. Approximately 9% of the population has this type of foot. If your second toe is longer than your first toe, then you have what's called a Morton's foot or a Greek foot. Approximately 22% of the population has this type of foot. If your first toe is the longest, then you have an Egyptian foot. Approximately 69% of the population has an Egyptian foot. Since the great toe was designed for carrying more weight and load than the second and third metatarsals, it is not uncommon to see stress fractures in individuals who have a Morton's foot.